This is my dog Blackberry. She is almost 2 years old. 2 days ago, she had a medial imbrication of her left knee for a luxating patella. We are making this video of hopefully helping somebody in the future that when they see this video, they'll at least have some more information than we did before we got her this surgery. BB had probably a grade 2 or grade 3 medial luxating patella. She was born with the condition. At first it was just a skip that she had in her step. She was getting around fine, not in any pain, not bothering her at all. It's just that every once in a while she'd skip, and at first we thought it was really cute that she was skipping. But when we took her to the vet, they said that she had a luxating patella. About a week ago, I'd say maybe about 5 days ago, she started to not put any weight on that left leg at all. She was limping around, not skipping, but just not putting any weight on that knee. So we were very worried. So we took her to the vet, and they decided to do a surgery for her. Right now, she has what's called a Robert Jones bandage on her left knee. I kind of modified it because she seemed very uncomfortable. There was actually a part where it came too high. I'm sure you can see it in the video, but because it got too high, it kind of rubbed her a little bit raw in this area. So I had to cut a little bit of that part off. And also, I guess, technically a real Robert Jones bandage is supposed to come all the way down to the foot, which they did have it that way. I just decided to cut a little bit off just to give her a little bit more comfort, especially when she's walking around. Excuse me. As you can see, she likes to lay down around a lot. She was a very active dog before the surgery, running around like crazy, going up and down the stairs very well. To the point where we couldn't even stop her from doing it. But after the surgery, she's been very tired, whiny. I'm guessing she's in a lot of pain. She has a patch on her back. If you are familiar with medications for humans, it's a fentanyl patch. Of course, it's not the same doses as humans. But for hers is 25 micrograms per hour. The normal human dose is about 75 micrograms per hour. It's been 48 hours since she's had that patch on, so I don't think it's any good. Usually about 2 days after putting the patch on, it's no longer effective. But they stapled it onto her skin. I don't know if you can see it here, but there's some staples like right here, some staples on there. So I don't have a staple remover, and I don't want to force those off. The vet told me to just keep that on until we go in for a bandage change on Wednesday, which is 2 days from now. As far as her bandage, they instructed me to check her stitches for any signs of infection twice a day. That is the part we've been having a lot of trouble with because this Robert Jones bandage, it's obviously it's not very easy to get off. It's about 4, I think, rolls of sterile Curlex inside, wrapped in 1 or 2 rolls of what's called Coflex, which is this blue stuff that you see here. To take it off, it takes a lot of time and effort, and not that that's a problem, but every time we do it, or every time we try to do it, she gives us a lot of whining. Seems like she's in a lot of pain. So I've kind of been reluctant to do that. She's on antibiotics, oral antibiotics, which is given to her twice a day. And for pain management, we're giving her meloxicam, which is a non-steroidal anti-inflammatory, or an NSAID that humans take, but it's obviously the dog dose. Let's see. Otherwise, she's pretty doing okay. She's eating okay. She likes to get fed instead of eating it out of her plate. She doesn't enjoy her favorite snack as much as she used to before when we gave her her dried chicken that we make for her. She never turns it down. But she's been turning it down every once in a while. She's been eating it better if we cut her into pieces. She's not drinking any water, which is kind of worrying me. She's been a big water drinker since she was very young, and she hasn't been drinking much water, so I had to force feed her water with a syringe. She hasn't gone to the bathroom number 2 since she's been back home, which has been over a day. So she has not gone, so I'm kind of worried about that too. We've tried to have her go. We put her on the pad, see how she's, see if she's going to go when she doesn't seem to like she wants to go. She's urinated, I think, twice. I don't think she wants to do it, and so she holds it for a long time. So the volume of urine has been a lot. As far as walking, let's see if she wants to walk a little bit. Baby, come here, baby. Come here.
Come here. Come here.
Come on, go to mommy.
Let's go inside. Let's go inside. Come on. Come on.
Come on. So she is walking around, as you can see. Pretty okay. She's like, that's perfect right there. She doesn't put very much weight on that left leg. She hops around. We're trying to have her exercise a little bit, walk about 5 minutes at a time, 2 or 3 times a day, as recommended by the vet. She does a good job of walking, so we're not too worried as far as that goes. But obviously it's very uncomfortable for her, so she wants to lay down as much as she can. Again, this is 48 hours after surgery for a medial luxating patella. If you have any questions, you can feel free to email me or message me. Thanks. Have a good day.